in association with Ayurvedic Practitioners Association, which is a main association of Ayurvedic practitioners and therapists together. And they are helping us to promote Ayurveda and do this as a trial. Now, introduction, these are just few points we're going to cover. What is APA, what is its mission, and what is the vision of APA. And little bit about Ayurvedic philosophy. Some of you who already have their pulse and constitution taken, they probably have spoken about some of the principles there. And then Zain is going to talk about the Ayurvedic therapies we do in Ayurveda. Now, what is APA? APA was set up in 2005, and I was one of the founding members, and I'm part of the committee they have. And we have 12 members and one lay member. And the vision of APA is to facilitate the health, happiness, and well-being of all. We manifest the truth of Ayurveda through unity and love. And we are hoping to combine all the Ayurvedic, there were 3 or 4 different groups of Ayurveda, and we hope to combine all of them together so that we can represent one single front to the government as well as to Indian Ayurvedic authorities and also to Europe and the whole world. And the mission is, it's committed to support all Ayurvedic professionals, that means Ayurvedic practitioners as well as Ayurvedic therapists. And there are two distinct and that ensures that all professionals have adequate education and training in Ayurveda. So APA makes sure that everybody who is training in Ayurveda, they are doing it through the proper channels, and not anybody who's just doing weekend courses are coming up and practicing Ayurveda. Now, these are just APA's objectives and aims, and basically it helps practitioners to set up and also how they are practicing through their practice, practitioners like myself and therapists like Zain. And we have about 50 to 55 Ayurvedic practitioners fully qualified like myself in whole of the UK. And there are a few therapists, some therapists as well who have full Ayurvedic training, who are associated with APA. So if you know that somebody has got APA or they are associated with APA, you know that they are credible people. So if you want to look out for an Ayurvedic practitioner or a therapist, you have to go to APA. Now, there are 3 categories if anybody is interested to become a member, or if anybody is interested to learn about Ayurveda and become a therapist or a practitioner. Is that we have full membership, which, like myself, Ayurvedic practitioners, they become full members, and they are called BAMS doctors, which is Bachelor of Ayurvedic Medicine and Surgery, and we have a surgical part of Ayurveda as well, which is not practiced here. And then we have associate membership, like Zain is an associate member, so all the therapists, they become associate members. And then we have student membership, people who are learning Ayurveda still, they're going through, they can still become members, but they are student, they go through student membership. So this is one of the pages Zain copied from our website of APA. So if you want to look up, you can look up through the region as well, or you can just type in, if you know somebody's name roughly, you can type in and give you details of all the practitioners and therapists. And they are the credible people to go and get yourself treated. Now, that's just very briefly about APA. We have got some leaflets and some more information, and you can go on the website and have a look there as well. Okay, sure. And I'm just going to talk about very briefly about the principles and history of Ayurveda. I have talked to a few of you, and Ayurveda is the oldest system we have in the world, and it's a fact historically. It comes up from about 5,000 years ago, or even much older than that. And it was originated in India or Indian subcontinent around that time. And you can say similar to Chinese medicine in the sense that it's complementary, it's natural, it's traditional medicine system. Ayurveda, what does the word mean? It comes from Sanskrit word Ayu plus Veda. Ayu means life and Veda means knowledge, or Vid, to know your life. And it's not just about disease. Modern medicine is mainly about treating disease. It's a disease management system, whereas Ayurveda is a health management system. how we live our life even when we are healthy. So living our lives, as this shloka says, in all its four forms, when we are healthy, when we are unhealthy, when we are happy, and when we are sad. So it's actually a way of life. Philosophy of Ayurveda comes from Sankhya school of philosophy, according to which we have two forces in the world, male energy and female energy. It comes together and it gives rise to five main elements in the universe, and those that we look at the disease come into being. Is we have incompatible, maybe dietary, we haven't eaten properly, there are some dietary things involved. Maybe there is stress or other lifestyle factors, as we know in the modern way, we are drinking or smoking or all those things. That is leading to hyperfunctioning of what we say Jatragni. Jatragni is the digestive fire. So our digestive fire gets dampened because we are eating all those things which may be not according to our body type. That leads to formation of ama. Ama is the undigested or improperly digested secondary metabolites in our digestive system. And it's not just in Ayurveda, any traditional system in the world, they say if you are ever in doubt, you treat the digestive system first. That's the treatment they always give in Western herbal medicine, in Chinese herbal medicine, always treating the digestive system. Also because most of the traditional medicines, they are in the form of herbs. So if our digestion is not working properly, we cannot digest the medicine and it won't work for us. So we have ama, and then ama causes the imbalance of any of the doshas, and then we have the disease manifest. But what Ayurveda is saying, and that's why Ayurveda believes in prevention, is to stopping at very early stages and not getting to this stage of disease. So knowing what our constitution is, knowing what we need to eat, what we should eat according to our time. Now these are the branches of Ayurveda. So we have 8 branches of Ayurveda treating various parts of our bodies. We have internal medicine, all the various herbal formulations and mixes, they are all described in Kaya Chikitsa. We have a huge side of surgery, and it is very, it's not practiced here, but it's practiced in India. You can do post-graduation in surgery, and then you can do Ayurvedic surgery. And similarly, we have Shalake and then pediatrics, toxicology, because in those days people used to get bitten by animals and insects and snake and all those things, and they needed to know how to counteract those. And we have psychiatry, which is a lot of mantras, and we are doing affirmations and visualization, meditation. That is all part of psychiatry. Rejuvenation medicine, which is actually a lot in limelight at the moment because there's a lot of research going on Rasayana drugs because they are helpful in HIV and AIDS and cancer treatment. So there is a huge focus on rejuvenation or Rasayana therapies, and Vajikarna is the reproductive medicine they use in India, in Ayurveda, in men's health and female health. Now, this is just the practical side of Ayurvedic consultation, how it's practiced here. For example, if somebody comes to me, the first consultation is for 1 hour, maybe 1 to 1.5 hours, and then medicine is given after that according to your body type. Your pulse is taken, your facial, some people do facial diagnosis, tongue diagnosis, and nail and skin, all of that is included. And then a management plan is devised because this is natural medicine. It's not like I give you a pill and it works for you. It doesn't work. It has a partnership aspect to it. You have to do certain things from your side, and then herbs or medicine will do certain things for you. So both has to work together. So management plan, which is applicable, which is practical to patient as well as to practitioner, is designed. And then generally, for example, I prescribe herbs, then there is diet plan, there is maybe yoga, there is meditation, if that's relevant to that patient, and then therapies like Shirodhara or other therapies. So if ever in doubt, if you want to take any Ayurvedic medicine, go to a practitioner, go to a therapist, so that they know what best to prescribe. If they don't know, they can find out for you, rather than going and buying anything over the counter. That's where the main problem lies. So don't go to a doctor. They don't know anything.